Hi everyone, it's January 6th, day 17 of my recovery. Yeah, it's going to be 3 weeks in a couple of days. On Tuesday, I have my next follow-up appointment with my surgeon. I haven't seen him since week 1, the end of my first week. Looking forward to going to see him just, to make sure that, just to get the reassurance that everything's going the way it needs to go. I would love if he would be like, oh, go ahead and start chewing. But that won't be happening. I'm for sure he's not going to do that. I'll have another week afterwards where I can't chew. That's probably my biggest thing right now, is that I'm so ready to bite into things, to chew. This no chew diet is not fun. I'm getting around it a lot by just swallowing things whole, which is weird, and I don't necessarily enjoy it. I'm sure it's not that great for digestion and stuff like that, but I'm just doing it because I'm getting desperate, and it's getting hard to I don't want to eat just oatmeal and soup, and I don't know, I ate a cinnamon roll yesterday night and it was delicious. So anyway, updates. Oh yeah, I didn't do profile views last time, and I can't forget to do that again this time, because last time I forgot, so I need to remember. At the very end, I'll do them. Updates, I guess, the biggest thing is swelling has gone down. I'm still swollen. I feel like I'm more swollen on this side, my right side, which is where I had the majority of my work done. The most movement was done on this side. I'm still, I think I'm not pretty. I'm just a little swollen, around here and around here. Maybe a little bit along the jawline, but yeah, it is worse on this side. My incisions are healing. This one isn't as bad. This one's stands out a little bit more. I mean, I'm prone to hyperpigmentation just because that's just how my skin is. So any issues I've ever had with my skin, my face, and whatever, I've always left marks. So I wasn't expecting them to fade completely. My surgeon's oh, you won't be able to see them in 4 weeks, but I'm sure I will, just because that's how my skin is. I saw my dermatologist yesterday, and she told me that I really shouldn't. She likes to wait at least 4 weeks for the wounds to heal before she starts putting anything on it. So I'm not really putting anything on it, other than she said my surgeon told me to quit using bacitracin, but my dermatologist said I could use it at night. I haven't started doing that yet, but I might start trying to do that. I guess the other thing is my range of motion. I can open my mouth more than I could. At first I could fit 1 finger. Now I can 2. I'm so excited. I gotta get to 3. That's where I was. I've noticed that when I eat things with forks, sometimes it doesn't fit. So I don't know. Plus I take big bites, so I probably should stop doing that. But range of motion, I have a little bit less of it on this side. I think I talked about this before, but I think my lower jaw is canted. My mandible, if you look at my teeth, yeah. It's goes down a little bit. I'm lower on this side. I'm assuming that it's an occlusal cant. I don't know how much will be able to be done. I'm hoping something. She's gonna have to close my bite, because I've said before, my bite's open on this side. It's closed a little bit. It's closed a little bit more than it was on this side. That's what I'm really looking forward to. I'm really looking forward to starting to see my orthodontist again, so she can start moving stuff around and having it feel better. I mean, my bite feels great compared to what I used to have, but I just know that I'm hitting certain teeth soon. I'm hitting on my brackets, and it's some of my teeth are a little bit sore from the contact that they're not used to having. So yeah, just yeah, I really want that fixed if they can do it, but I guess it's not the worst thing ever, and if I have to live with it, I'm fine. It's gonna be okay. My incisions, I still have stitches in my mouth. It's been almost 3 weeks, and I still have stitches, on both sides. They're there. I don't bug them. I'm not supposed to touch them or anything, but I had thought that they would have dissolved by now, because they said 1 to 2 weeks, but I guess it's not hurting anything by having them be there, so I just kind of, I'll check them out just to see if they're there, but I just kind of ignore them other than that. Um, what else? I'm back to sleeping normally for the most part. I try to sleep on my side or on my back if I can, but I really am like a stomach sleeper. Like, I love to sleep on my stomach. I fall asleep easier that way, so I kind of usually end up there. And I haven't noticed any like issues. I hope that I'm not doing anything. Like, I hope I'm not hurting anything or, you know, slowing recovery for whatever reason by putting pressure there. He told me I could do whatever I wanted, so that's why I have been. Um, I haven't really had any pain. Um, just like at, you know, like the whole range of motion, like my TMJ, I'm not able to open as much as I can. You know, I didn't have surgery on that part of my mouth, so I'm assuming that it's just like sore and like swollen still maybe, and that's why or the muscles or scar tissue or something that's causing it to not open as much. I'm gonna have to talk to him about that at my next appointment, because I didn't really bring it up that much. I mean, he had mentioned my range of motion and how open your mouth, see how far you can open, kind of like that, but we didn't really talk about why I wasn't opening more or when I will be able to and stuff. And so we'll try to figure that out. Let's see. What else? I don't know. I go back to school on next Wednesday, so it'll be day 22 that I go back to school. Not worried about it. Like, honestly, I probably could have went back to school like this week and been fine, as long as I didn't talk all day long. Because I do notice that if I like talk a lot during the day, which I've started to do more, sometimes at night I am a little bit like sore. But it's never that bad. I don't take any of my medication anymore. I've stopped rinsing with the chlorhexidine, and I've stopped doing my saltwater rinses just because they're a pain, and I don't like how they taste. The chlorhexidine tastes like poison. I can't stand it. It alters your taste buds, makes everything that you eat taste differently. So as soon as like 2 weeks was over, I stopped doing it. So I hope that's okay. But anyway, okay, I guess I can't think of anything right now. If I have any like big news for you guys after my 3-week update, I'll make a video again, a really quick one. But if not, it might be a while before I make another one, just because I don't really think about it, and I'm gonna be back in school, and I'm gonna be really busy once school starts. So, okay, I'll just do some of my profile views. Okay. Okay. Alrighty. Well, I'll see you guys next time. Thanks.